3 people per million per year are diagnosed with the rare non-malignant brain tumor that I had. Now, I know after my diagnosis, I asked my medical team, I asked Dr. Google many questions about symptoms, treatment, and they were able to give me many of the answers. But I also really wanted to understand what my quality of life would be. That would make sense, right? But often they weren't able to give me really the answers on how my quality of life would be impacted by my brain tumor. Now, as a young mother and wife, I wanted more. I wanted to be more engaged and more active in my healthcare. I look back at my patient journey and my symptoms and my treatment, and I began to realize that this journey contained a host of untapped information and data on disease and my quality of life. And I thought this information could really be used and harnessed, and maybe with other patient journeys, and could be used to alter the future healthcare management of our condition. And this idea was spearheaded by a collaborative study at Johns Hopkins University between patients and healthcare professionals. And we collaborated and we created very meaningful data, which was then used to create a positive change in the management of our healthcare condition. Now, this idea really didn't just start with me. It can actually start with each and every one of us. And how can this happen? Well, for patients, it really stems with looking at how we as patients can be more responsible in the management of our own treatment and our own healthcare. And as healthcare professionals, it's all about how receptive we are to patient data and how collaborative we are with our patient relationships. And as a researcher, it's all about looking at the quality of life data that is out there and how we can use it to better patient outcomes. So I want to ask you today, how can you take one of these actions and really use it today to help better the future healthcare management within our system?